Hello, my name is Dr. Joe Adeboyega, practicing licensed clinical addiction specialist in the city of Winston-Salem, North Carolina. Schizophrenia is a mental disorder that makes it hard to tell the difference between what is real and not real, or think clearly, or have normal emotional responses, or act normally in social situations. What are the causes of schizophrenia? Schizophrenia is a complex illness. Mental health experts are not sure what causes it. However, genes may play a role. Certain events may trigger schizophrenia in people who are at risk for it because of their genes. You are more likely to develop schizophrenia if you have a family member with the disease. Schizophrenia affects both men and women equally. It usually begins in the teen years or young adulthood, but it may begin later in life. It tends to begin later in women and is more mild. Childhood onset schizophrenia begins after age 5. Childhood schizophrenia is rare and can be hard to tell apart from other developmental problems in childhood, such as autism. What are the symptoms of schizophrenia? Schizophrenia symptoms usually develop slowly over months or years. Sometimes may have many symptoms, and at other times may only have a few symptoms. People with any type of schizophrenia may have trouble keeping friends and working. They may also have problems with anxiety, depression, and suicidal thoughts or behaviors. At first, you may have the following symptoms: irritable or tense feeling, trouble concentrating, trouble sleeping. And as the illness continues, you may have problems with thinking, emotions, and behavior, including bizarre behaviors, hearing or seeing things that are not there, which is hallucination, isolation, lack of emotion, flat affect, problems paying attention, strongly held beliefs that are not real, delusions, thoughts that jump between different topics, loose associations. Symptoms depend on the type of schizophrenia you have. Paranoid schizophrenia symptoms may include anxiety, anger, and arguing, false belief that others are trying to harm you or your loved ones. Disorganized schizophrenia symptoms may include childlike behavior, problems thinking and explaining your ideas clearly, showing little emotions. Catatonic schizophrenia symptoms may include grimacing or other odd expressions on the face, lack of activity, rigid muscles or posture, not responding too much to other people. Undifferentiated schizophrenia may include symptoms of more than one or one other type of schizophrenia. What are the tests and exams? There are no medical tests to diagnose schizophrenia. A psychiatrist should examine you to make the diagnosis. The diagnosis is made based on an interview of you and your family members. The healthcare provider will ask questions about how long the symptoms have lasted, how the ability to function has changed, developmental background, genetic and family history, how well medication have worked. Brain scans such as CT or MRI and blood tests may help rule out other conditions that have similar symptoms. The treatment. During an episode of schizophrenia, you may need to stay in the hospital for safety reasons. Medications. Antipsychotic medications are the most effective treatment for schizophrenia. They change the balance of chemicals in the brain and can help control symptoms. These medications are usually helpful, but they can cause side effects. Long-term use of antipsychotic medication may increase your risk for a movement disorder called tardive dyskinesia. This condition causes repeated movement that you cannot control, especially around the mouth. Call your healthcare provider right away if you think you may have this condition. Support programs and therapies. Supportive therapies may be helpful for people with schizophrenia. Behavioral techniques such as social skill training, can be used to improve social and work functioning. Job training and relationship building classes are important. Family members of a person with schizophrenia should be educated about the disease and offer support. It is important that the person with schizophrenia learn how to take medication correctly and manage side effects, notice the early signs of a relapse and what to do if symptoms return, cope with symptoms that occur when taking medication, manage money, use public transportation. What are the prognosis? The outlook with schizophrenia is hard to predict. Most of the time symptoms improve with medication. However, some people may have trouble functioning and are at risk of repeated episodes, especially during the early stages of the illness. People with schizophrenia may need housing, job training, and other community support programs. People with the most severe forms of this disorder may not be able to live alone. They may need to live in group homes or long-term structured residences. Symptoms will return if you do not take medication. Possible complication. Having schizophrenia increases your risk for developing a problem with alcohol or drugs. This is called a substance abuse problem. Using alcohol and other drugs increases the chances your symptoms will return. Physical illness. People with schizophrenia may become physically sick because of an inactive lifestyle and such side effects from medication. A physical illness may not be detected because of poor access to medical care and difficulties talking to healthcare providers. Also, another complication is suicide. Prevention. There is no known way to prevent schizophrenia. Alternative names is childhood onset schizophrenia. If you would like to read more and know more about this disease, go to NIH, National Institute of Health, Mayo Clinic, WebMD, or Medline Plus. Thank you.